The first step in the process of MS-DRG assignment is determining whether the case qualifies for a pre-MDC or not. Normally, inpatient cases are grouped by the principal diagnosis, but there are some very costly and complex encounters that need to be assigned to payment groups based on the procedures performed. These are also cases where the diagnosis assigned might not be a good indicator of the severity of the illness or the necessary resource use. For example, tracheostomy procedures could be performed for injuries, cancer, respiratory diseases, etc. A principal diagnosis of neoplasm of larynx might not correctly reflect how intense this one case turns out to be, and because of this, the case will end up in its own special group, a pre-MDC, instead of getting assigned to MDC03 for the throat malignancy. MDC03 would not reimburse the hospital for the costs associated with tracheostomy and all related care. In the latest grouper version for 2021, in version V38.0, we have 11 pre-MDCs. You can see the list here: chimeric antigen receptor, heart transplant, ECMO, liver intestinal transplant, bone marrow transplant, etc. If we click on any of these categories, we can see, let's try this one, we can see the list of procedure codes that can qualify a case for pre-MDC assignment. If the patient we are coding for had any of these procedures performed from this list, they will be immediately assigned to this DRG 007. If a patient qualifies for any of these procedures or anything else from the list here, any other one of these within these pre-MDC DRGs, then the DRG assignment process stops and ends right here. We found our case, this is where we end. Again, this is only for these given procedures listed here. Please take the time to click on all of these groups and review the procedures associated with them to have a better understanding as to what you are looking for when you are coding for inpatient cases. Now, if the case does not qualify for a pre-MDC because the patient didn't have any of these procedures performed, then we have to proceed with the usual process and find the correct DRG based on principal diagnosis, secondary diagnoses, and lesser procedures if performed.